Okay, first I'm gonna explain the items that I have here. I have wound cleanser, which is perfect because we have 8 to 10 PSI, which is great for irrigation. I have all my supplies here on a clean field. We're gonna be removing this dressing, so nothing here is gonna be sterile. I have my tape measure. These are going to be my devices to do my measurements with. My normal saline and my ABD pad for my dressing. So first thing I'm gonna do is definitely make sure that the patient has been assessed for pain, and if he is he or she is experiencing any pain, we wanna give medication appropriate for whether it's IV or PO and the time frame so that the medication is in their system when we do the dressing change. So I've washed my hands, I've explained what I'm gonna do to the patient, and I've got my gloves on, and I'm going to first remove the dressing. Put that here in my biohazard bag, and then I'm going to use my wound cleanser, and I'm going to spray the entire wound around. I'm going to wipe it out, pat everything dry. I will wash my hands again and put new gloves on, and then I will come over to measure. So measuring is important. You have to measure from the head to toe for your length, and the width needs to be from side to side. So this wound we would measure is 9 centimeters by 2.5. There is tunneling under here at 7 o'clock, and that is 4 centimeters. You see the rolled edge here, so that tells you that there's some undermining on here. So the undermining goes from 1 o'clock to 3 o'clock, and it's about 2 centimeters. As for the depth of the wound, you always want to measure the deepest part, and the depth of this wound would be 2.5 centimeters. So now we're going to pack the wound and put the medication on. This wound here has some yellow-brown slough in here, so we're gonna put medication on there called Santyl, and we'll put that at nickel thick all across the wound, just the necrotic area. Then this portion, we'll go ahead and pack in here through the tunneling. Don't want to push too tight, you just want to fill in that dead space. And then we're going to do the same here underneath the undermining. And then we'll also fill in this area here. We would normally use packing strips, but I'm improvising and just using gauze. Then I would just cover with the ABD. Tape the wound, and then remove all the supplies and trash, take out to the biohazard. Make sure the patient is tolerated the procedure, is doing well, everything's good, and then we'll move on to the next video.